So today I'm going to educate and inform you about bipolar disorder and how with proper medication and lifestyle management, people with bipolar disorder can actually live full, satisfying, and productive lives. Imagine the best day you've had in your life. Everything is going your way, you feel great about yourself, and you have boundless energy. The sky seems bluer than it ever has before. The sun is shining and just warm enough, and the birds are chirping. Everything seems exciting and fun. Life is just great. What a wonderful life this is. Now imagine the worst day you've ever had in your life. You're tired, maybe a little bit worn down, maybe not feeling very good, and maybe nothing seems to be going right. Maybe it's crappy and wet and cold outside, all things that can affect how you feel. You just want to curl up in bed, pull the covers over your head, and sleep until this horrible day is over with. People with bipolar disorder experience life much like this, only at much greater highs and much greater depths. The symptoms associated with bipolar disorder can be extremely detrimental to the lives of those cursed with the illness, resulting in damaged relationships, problems at work and school, and unfortunately can even claim life, as 1 in 5 people with the disorder commit suicide. All of that paints a really bleak picture, I know, now that you're all depressed. But bipolar disorder can be treated, and people with this illness can lead full, satisfying, and productive lives. So what is bipolar disorder? The National Institute of Mental Health defines bipolar disorder as a brain chemistry disorder that causes unusual shifts in mood impacting the ability to carry out day-to-day tasks. Most people experience ups and downs in their lives. This is normal, sometimes on a daily basis, but the moods experienced by someone with bipolar disorder are a little bit different. Extreme changes in energy, activity, sleep, and behavior go along with these changes in mood. People with bipolar disorder experience episodes of overly joyful or excited states called mania, and extremely sad or hopeless states called, well, obviously depression. Guidelines from the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, assist doctors in diagnosing bipolar disorder when symptoms are unusually intense and are a major change from normal behavior. NIM, or the National Institute of Mental Health Disorders, identifies 4 basic types of bipolar disorder. There's bipolar disorder 1, which is defined by manic or mixed episodes that last at least 7 days, or by manic symptoms that are so severe that the person needs immediate hospital care. Usually depressive episodes occur as well, typically lasting at least 2 weeks. Bipolar disorder 2 is defined by a pattern of depressive episodes and hypomanic episodes, which I'll explain in just a second what hypomania is, but no full-blown manic or mixed episodes. Bipolar, not otherwise specified, is diagnosed when symptoms of the illness exist but do not meet diagnostic criteria for either bipolar 1 or bipolar 2. However, the symptoms are clearly out of the person's normal range of behavior. Cyclothymia is a mild form of bipolar disorder. People with cyclothymia have episodes of hypomania as well as mild depression for at least 2 years. However, the symptoms do not meet the diagnostic requirements for any other type of bipolar disorder. Sometimes people with bipolar disorder will experience symptoms in which mania and depression occur simultaneously. This is called a mixed state. During a mixed state, people feel agitated, they might have trouble sleeping, and they might experience major changes in appetite. People in a mixed state may be very sad at the same time, feel extremely energized. This can be very dangerous, and sometimes suicidal thoughts or trying to actually attempt suicide can occur during a mixed episode. Some people with bipolar disorder experience hypomania, which is a less more severe form of mania. During a hypomanic episode, they may feel very good, be highly productive, and function well. It can also result in psychotic symptoms as well, which can be very scary for patients. These symptoms may occur during manic or depressive episodes, and people with psychosis may believe they are famous or godlike. They think they might have a lot of money, or sometimes they might feel that they don't have any money at all, or they're homeless. They might even feel that they have special powers. Often because of these delusions, people with bipolar disorder are misdiagnosed as schizophrenic. A severe form of the disorder is called rapid cycling, which occurs when a person has 4 or more episodes of major depression, mania, hypomania, or mixed states, and all in a year. The International Journal of Qualitative Studies on Health and Well-Being cites that 90% of patients with bipolar disorder will have recurrent episodes of the illness, and the suicide risk is estimated at 6 to 15% during depressive as well as manic episodes. Although 25 to 50%, sadly, with bipolar disorder will attempt suicide at least once in their lives. According to DVSA, approximately 60 million adult Americans, or about 2.6% of the U.S. population aged 18 and older, are diagnosed with bipolar. Recent studies show, however, sadly, that the incidence of prevalence has been seriously underestimated and suggests that it could be as high as 3 to 6%. The median age of onset for bipolar disorder is 25 years, although the illness can start early in childhood or as late as the 40s and 50s. Equally, numbers of men and women develop bipolar disorder, and it's found in all ages, races, ethnic groups, and social classes. More than 2/3 of people with bipolar disorder have at least one close relative with the illness or with unipolar depression, indicating that the disease has a hereditary component. The family and friends of people with bipolar disorder are often silent sufferers because they want to help their loved one get better, but many times don't understand the illness fully, or they don't know how to deal with the sometimes erratic behavior. Margarita Tartakovsky offers many solutions about how to manage bipolar. Some people with bipolar disorder develop strategies to stay healthy and avoid recurrent relapses. By identifying early symptoms and taking action to avoid slipping further into full-blown episodes, bipolar can be successfully managed with medication, therapy, and controlling stress, sleep, and physical activity. Russell and Brown state that getting an accepting diagnosis is the first step to managing and staying well with bipolar disorder. Because the symptoms often mirror that of other mental illnesses, getting the correct diagnosis is the first step to managing it. Then accepting the diagnosis, which is hard to do sometimes, and understanding the need for mindfulness and being aware of responses to the physical, mental, emotional, and social environments help to identify triggers to episodes and can offer the opportunity to control sources of imbalance. Getting proper sleep, exercise, and practicing methods of stress relief can contribute to overall health, but also keep the symptoms of bipolar disorder under control. Learning to recognize small changes in these patterns also provide an early alert system that something is wrong and needs to be addressed to stay healthy. Also, finding the correct pharmaceutical cocktail can be a challenge, as hormones, neurotransmitters, and other chemistry differ from person to person. Once the right medication is found, maintaining a schedule and staying disciplined to taking it is crucial. Complementary therapies like cognitive behavioral therapy, hypnotherapy, nutritional supplements, naturopathy, psychotherapy, and relaxation techniques, as well as things like yoga and massage, also offer benefits to people with bipolar disorder, contributing to sustained wellness. All in all, living with and managing bipolar disorder can provide challenging for people suffering from the mental illness. Through diagnosis, education, medication, therapy, and lifestyle management, it is possible for people affected by the illness to live full, satisfying, and productive lives. Thank you.